All right, first and foremost, I'm Dr. Moore, and I'm going to be assisting you today. Mr. Page, can I have your ID, please? Mr. Ram, did you hear me?
Yes, sir. Yes, Doc. I'm trying to find it here.
Okay, thanks. All right, you're 36 years old. Thank you for that. Can I also see your passport? All right, perfect. So what we're gonna do is we're gonna run some X-rays and see what kind of bullets are in you, if there's any bullets in you. Was this just happened?
Oh, yeah, Doc. Yes, it just happened.
All right, perfect. I'm gonna run some X-rays on you, and we're gonna get started. Perhaps can you tell me where you got shot? Was it your leg? Was your arm? Where did you get shot?
I believe it was in the chest.
Okay. Let me see what I can find in there. That was spelled wrong. Oh well. All right, sir. It appears it's popping up some bullets in there. It appears there's two in there. What I'm gonna do is I'm gonna have to put you under some anesthesia and put you under and proceed with the surgery and get those bullets out before any infections appear. Is that okay with you?
All right, how long is that going to take, Doc?
Well, it just all depends on how deep the bullets are in there. From what my X-rays are showing, it's like a hairline, in your skin, so it shouldn't be that long. But I could proceed and do the surgery if you'd like to get those bullets out, so you're no longer in pain.
Yeah, let's go ahead and do that, Doc.
All right, perfect. What I'm gonna do is I'm gonna hand you this gown, and I'm gonna have you get dressed in this other room, and we're gonna proceed with the surgery. So I'm gonna hand you a gown. You're gonna go get dressed for me. All right, sir. Here's your gown for you, and I'm gonna have you walk over here and get dressed, or you could actually stay in this room if you'd like, and I'll walk over here and let me know when you're done, and we'll proceed with the surgery. Mr. Ram, how you doing? Mr. Ram, how you doing? Oh, I couldn't hear you. What were you saying?
We're ready to go.
Oh, that's so weird. My volume was down. I couldn't hear you. That's so weird. All right. What I'm gonna do is I'm gonna have you lay down on this bed, and I'm gonna give you some anesthesia and put you under. If you can just count from 10 backwards, and then once you get to number 1, you should be under that anesthesia, and you shouldn't feel anything while I'm proceeding the surgery. All right, sir, I'm gonna hand you some anesthesia. Giving. All right, sir, can I have you count from 10 backwards for me?
10, 9, 8, 7, 6, 5, 4, 3.
All right, patient's unconscious. Anybody on the walkie-talkie? Oh, no. Oh, boy. Where's the friends? Oh, my God.
Why are you sitting down right here? What's up?
Hey, dear, can I have you in the surgery room with me? I just need to make sure this patient's vitals are staying idle as I proceed with this surgery with 2 bullet wounds in his chest.
I'm actually in mid-interview right now. Could you give me like 5 minutes? I'm on the last 3 questions.
I can try to find somebody else because I actually just put the patient under anesthesia, so...
Oh yes, everybody else, and if anything, I'll come peek in there when I'm done.
All right, no problem. Oh, hell no. How did you get in there? Hey, doctor, I need you to assist me if you can.
You know I'm always available to help.
No problem. I'm actually downstairs in the surgery room. I just need you to proceed to check the patient's vitals as I proceed with the surgery. Patient has 2 bullet wounds, and I am going to... Patient's currently under anesthesia, so can we make our way downstairs?
Open the door.
Why'd you go in there?
Open the door.
Why'd you go in there? Alright, yeah, just make sure those doors stay shut. Alright, if you could just, keep checking that patient's vitals as I proceed with the surgery, that would be wonderful. there is some, blood dripping on the floor. Just make sure if you can catch it with some gauze right here so it doesn't get everywhere. If you could go set this bullet that I just pulled out, oh boy, it was a pretty long one, over on that table, that'd be great.
Sorry, repeat that.
If you could just set that bullet that I set down right here on that table over there, as I pull out the second bullet in this patient. All right, let me run. Why do I have my taser out? Let me run an X-ray real quick.
Look at y'all. Y'all look so happy with the door closed. Okay, bye.
All right, X-rays came out good. I'm gonna just put some bandages on his wound right here, and then patient should be waking up here shortly. Then he is gonna have to go to the recovery room. If you don't mind taking him to the recovery room as soon as patient appears to be woken up. We are gonna have to have a wheelchair come in here. Patient is going to be, in a little bit of pain. All right, Mr. Ram. You are, you're still under that medicine I gave you earlier. I don't know if you recall, but you are going to be going in a recovery room if you don't mind recovering here for about 10 to 15 minutes, if that's okay with you.
Elevators are right here. There's still.
Sir, can you please lay down on the bed for me right here? Can't lay down on this one? What the hell?
It doesn't show you on the side of your screen what floor it's on.
Well, I'm gonna be prescribing you some pain medication. If you could please take it daily as recommended on the bottle. Please take it when you are feeling that pain. Please do not, take it if you're not feeling any pain. Please drink, a good amount of liquids, if you can. And doctor is going to be, sitting in here with you as you recover. And once he feels that you are ready to be discharged, you are free to go. I believe.
Your elevator? How you elevator?
I believe you're good to go, and I can make a follow-up appointment with you in about 2 weeks. If Mr. Doctor, you could do a follow-up appointment in 2 weeks to see how a patient is recovering after the stitches, that'd be great.
Sounds like a plan. So Ram, what time works best for you? Let's say, what you think, Anthony? Monday, or what day works best for you next week?
Let's do Thursday, or let's do a Thursday.
All right.